Welcome everyone to today's video where we are talking dry skin, or is it estrogen depletion? Depending on your age, it could be estrogen depletion. So let's learn a little bit more about that. I hate to keep you waiting, so let's dive in. So 3 different types of estrogen. First, we have the estrone. And estrone is the weakest form, and in menopause is what you're left over with. So that's fine, it does its job, but it's just kind of there. Estradiol, this is the most potent form of estrogen, and it really starts to increase during our puberty years. So it's going to make us curvy and voluptuous and soft. It's going to bring on our cycle. It helps regulate our cycle. It is what really makes us a woman. And then lastly, we have estriol. Estriol is our type 3 estrogen, and this increases when we're pregnant. So probably not happening when you're in menopause. So menopause, you're stuck with E1, and it might not be doing enough for you. So through our life, we really don't notice, but as our estrogen levels change as we get older and they start depleting, weird, unexpected things start happening, and you may not be pinpointing that to estrogen. So first of all, I just like to talk body health and estrogen. Cardiovascular disease. Once you enter menopause, your risk for cardiovascular disease increases. And we have these signs and symptoms going on years before people may not be noticing. So high cholesterol, high blood pressure. So those are signs of cardiovascular disease. Once the arteries become stiff, that's going to make the blood harder to pump, and that increases blood pressure. Together with high cholesterol, you have cardiovascular disease and could end up with a heart attack. So doctors try to stave that with medication, but are they using the right medication? Maybe the whole time it's just been estrogen depletion, especially if your diet is good, you've been exercising, you're happy, you're not drinking too much, you really have a good, clean life. We shouldn't have high cholesterol or blood pressure. And bone health. So after menopause, women can lose up to 25% of their bone mass. 10% of that just within the first year. So that has a lot to do with estrogen. It shows you how important estrogen is throughout the whole body. But what about your skin? Have you ever thought that estrogen is related to your skin? Its firmness, its moisture, its elasticity, wrinkles. Well, it is, and it's pretty amazing what topical estrogen can do. So let's talk the different forms of collagen. So there's type 1 collagen. This is very heavy in the skin. So about 90% of the skin is type 1 collagen. And it helps the skin stay firm and plump. Type 2 collagen, it plays a little bit of a role in it. Not greatly. It does help with texture. And then type 3 collagen, again, more of a role with your collagen. It's really going to help decrease wrinkles. So firmness in the skin, again, too, and some elasticity, flexibility in the skin. It helps things plump back and look good, moist. All of that is collagen. But what is telling the collagen to grow is your estrogen. So the solution to your dry skin and wrinkles really could be helping that collagen grow by topical estrogen cream. It's pretty crazy, isn't it? It's supposed to be used somewhere else. Now we're using it on the face. I think it's great. Is it safe? Believe it or not, studies do show that topical estrogen cream has little to no effect on your systemic estrogen and is considered safe and effective even if you're already taking hormone replacement therapy. Now, if you're a cancer survivor, obviously go to your doctor with this, but studies also show that topical estrogen, it's really not absorbed systemically. So that's not going to change your estrogen levels in your body whatsoever. But you could still get those skin benefits. So in as little, gosh, I think it was like 4 months, your dermis of your skin is about 20% thicker. You know what that means? That's going to mean fewer wrinkles. And I'm sure it's like, start small. It's going to be the fine lines. People are going to be happy with the fine lines. Keep doing it. Will that work on your deeper lines? Like, that would be very fabulous. So if you're in my office and you're looking for some topical estrogen, I usually will suggest something from Brezwecken, the Osteo V, or not like that one because it's a combination of estriol and estradiol. Or if a woman is just looking for regular estriol, you can do 100% estriol cream from Emerita. And I will leave those links in the description for you so you can look into those a little bit further. But it's just a little dollop on the face or maybe the knees or the thighs, wherever you're a little bit crepey and dry, twice a day. So just like regular moisturizing cream. It's pretty interesting stuff. I think it's really great. So maybe you'll try it. If you do, go ahead, leave a comment for me. Let me know. Please like, subscribe, and I'm going to be doing more videos. Talk to you soon.